Hi, my name is Charlotte Williams, and I will be discussing chronic disease management in the United States compared to Germany. So, chronic disease management is super important around the world, but it's specifically prevalent in the United States. It's the leading cause of death and disability in the United States, affecting over 60% of adults and accounting for 90% of the nation's 4.9 trillion annual healthcare expenditures. Diabetes, obesity, and heart disease are common chronic diseases in the United States, and we can see in this graph there are many more chronic conditions that add to these costs. Due to how large of an issue it is, the United States has to manage it somehow, and they do this by having chronic care programs, which is where if you have two or more serious chronic conditions that you expect to last at least a year, Medicare may pay for a health provider to help manage your care for those conditions. And this is covered by Medicare Part B. They also have self-management programs, which is federally funded programs that provide education to help patients manage their conditions at home. Along with the United States, Germany is another nation that experiences a large amount of chronic disease in their population. Over 53% of adults in Germany report having at least one chronic disease, and cardiovascular disease is specifically high in Germany compared to other countries. Germany deals with this issue largely with disease management programs, which are also known as DMPs, and they are structured treatment programs for chronically ill patients, which improve their quality and coordination of care. And there are many different DMPs that exist for several chronic diseases. Key components of DMPs are evidence-based treatment, patient education, which is where the patients participate in training to learn how to manage illness, documentation and coordinated care between specialists and rehabilitation facilities. And it's also free for patients with statutory health insurance. So, comparing Germany and the United States, Germany is more effective with lower costs and lower mortality rates, while the United States has higher spending and lacks preventative care, which Germany uses mandatory DNPs to improve care coordination. The US system is more fragmented, relying on varied health plans, and there are a lot fewer financial burdens in Germany to receive chronic care because of universal coverage, while in the United States there are higher rates of uninsured people. Um, so you think why wouldn't the US switch to this? It's because the United States has a mix of public and private insurance, which makes a unified mandatory nationwide program for chronic care illness difficult to implement, and there is also a lack of primary care coordination, and DMPs rely heavily on communication between primary care physicians. And here are my sources, and thank you so much for listening.